Hello everyone, I'm Professor Jeongmyeon Kwak from Korea University Annam Hospital, Korea University College of Medicine. In this lecture, I would like to talk about the anatomy and evidence review of complete mesocolic excision and central vascular ligation in colon cancer surgery. In the late 2000s, there was a critical concern that patient outcomes after colon cancer resection. Long-term follow-up data from classic trial also showed high local recurrence rate. With this method, Hohenberger documented a 3% reduction in 5-year local recurrence rate. There are three essential components. Although Hohenberger first used the term CME with CVR,